It's getting hotter, and that increases your risk of exposure to flesh-eating bacteria. This morning, Dr. Michael Kim joins us. Good morning, Dr. Kim.
Good morning.
So happy to have you here. We need to talk about how you can reduce your risk of getting flesh-eating bacteria. First, start off by telling us how you get infected with this.
Well, there's two main ways. From brackish waters, this Vibrio is a gram-negative bacteria, and it's similar. One type is cholera. We're all familiar with. You eat it, you get sick, diarrhea. That's probably the most common type of Vibrio. But there's a specific type of Vibrio vulnificus, which is one that we see in the Gulf. That's flesh-eating. So you can see it in oysters. So by ingesting infected oysters, we can get sick, vomiting, nausea, etc. The other way is through open wounds in the warm water. So we hear a lot of people, they swim around with an open sore and they get a terrible skin infection, sometimes amputation or death.
Oh, wow. And this flesh-eating bacteria, does this only happen when, temperatures get really hot?
No, it's generally in the warm brackish water. So the Southwest Florida is a perfect area and breeding ground for this type of bacteria. The picture you saw before, they couldn't show, it was a huge gash after debridement, losing half the leg.
Wow. And we know that this is a very rare condition, but there are several cases that come up across the U.S. each year. Talk about that.
Well, every year we hear about these people dying from it, and I think that there's about 200 cases in the United States, not a lot, and about 10, maybe 12 die a year.
Oh, wow.
But these are significant. A lot of these patients are usually immunocompromised. So if you're going through chemo, have cancer, have cirrhosis, liver problems, those are the patients highest risk of getting this deadly disease.
Wow, and we just saw a couple of the pictures there you have to blur out, but what kind of injuries specifically are we talking about? I know you talked about some gashes in the legs and things like that.
Well, if you're sick, going through chemo or cancer, and you come out of the water and you start getting these blisters and redness and sore, those are serious warning signs that you may have this. So any question about a wound from the water, you need to go to the emergency room right away, because if you treat it early, it's very treatable. But once you wait too long, you end up losing a limb or even your life.
Wow. And is there somebody that's more susceptible to this? Children, adults, elderly, or can it affect anybody?
Mostly patients for this particular type who are immunocompromised, as we mentioned, cirrhosis, going through cancer, certain types of issues that they're going through at the time, HIV.
Wow, and very quickly, is there treatment for this at all?
Yeah, antibiotics will treat it, if caught initially. However, if you wait too long and get that necrotizing infection, you can lose your life.
All right, Dr. Kim, thanks so much for joining us. We'll be right back.